Hello everyone. On behalf of the Access and Privacy Department, I would like to welcome you to Prairie Mountain Health. Our goal today is to give you a brief and informative review of your privacy and confidentiality responsibilities as a Prairie Mountain Health employee. Please know that you can contact our department with any questions or concerns you may have, and our contact information will be shared at the end of this video. Let the fun begin. Staff are obligated through legislation, Prairie Mountain Health policy, and in some cases their professional standards of practice, to protect confidential information and understand this obligation continues after their employment with PMH ends. Confidential information includes personal information like a client's name, home address, or email address. It also includes personal health information like a client's healthcare history, current treatment, or PHIN. As well, administrative business records that are of a legal, financial, or operational matter are covered under confidential information. Prairie Mountain Health is committed to protecting all confidential information and adopts administrative, technical, and physical safeguards to ensure the confidentiality, security, integrity, and availability of this information. I'm sure you're sitting out there right now saying to yourself, what is this woman talking about? What are administrative, technical, and physical safeguards? Well, funny you might ask. Guess what's next? Physical safeguards would include things like filing confidential records into a locked filing cabinet. Prairie Mountain Health also encourages following a clean desk philosophy, that is, keeping a clean, organized workspace so that confidential papers aren't lost or left out to be seen, and being sure to store client records in a secure location. These are all quick and effective ways to protect the privacy and confidentiality of those we serve. Easy peasy, am I right? Another important safeguard that I would like to touch on is the secure transportation of confidential information. There is a PMH security and storage policy that includes the requirements for transporting or traveling with confidential information. This robust policy contains many sections about your responsibilities when it comes to how confidential information is securely destroyed, stored, transmitted, or shared. This is going to be your go-to policy for direction and guidance about everything to do with storage and security of confidential information, from texting and emailing, faxing, leaving phone messages, and mailing, to working from home if that's authorized by your manager. Any removal of confidential information from its secure storage puts the information at risk, and it's imperative that you follow the requirements detailed in the policy to ensure the safety of this material. The policy outlines acceptable reasons for removal of materials from secure storage, like carrying out job duties in home care, for example, and this is something that you would need to be sure to discuss with your manager before taking confidential information out of its secure storage location. Some examples of your responsibilities when transporting confidential information include only removing the minimum amount of information that is required from the facility or office. A zipped binder, briefcase, backpack, or other secure carrier bag or container must be used to avoid the loss of information. Granted, it can be quite comical to watch someone chasing a piece of paper that lands only long enough for someone to bend down before it takes flight again. But your job is protecting confidential information, not miming an episode of Mr. Bean. On a serious note, imagine if that was your information flying around that identified your address, details about your care or condition, or your salary or performance records. A label or PMH business card must be kept in the bag or container in the event the information is lost or misplaced. You must keep the information in your custody at all times or temporarily stored in a secure location, such as a location that is not readily accessible by unauthorized individuals, a location that is supervised or monitored by authorized individuals, or locked in a room or drawer where unauthorized individuals cannot gain access. Confidential information is not to be left unattended in a vehicle, but when absolutely no other alternative exists, place the information in a locked trunk or in an out-of-sight location in a locked vehicle if there is no trunk. Under no circumstances is confidential information permitted to stay in a vehicle overnight. Administrative safeguards are actions such as employee orientation and ongoing training initiatives, signing of the Pledge of Confidentiality policies, and procedures that are implemented to protect confidential information. You can find Prairie Mountain Health Access and Privacy Policies, Procedures, and Guidelines, or PPGs for short, on the Prairie Mountain Health intranet by clicking on the intranet icon, then Policies and Documents, and using the search bar to locate policies or procedures using a policy number or keyword. We will search with the keyword police. This option will bring up any PMH PPGs that contain the word police and will help narrow down the search for you if you're unsure of the specific program or name of the PPG you're looking for. Going back, you can also use one of the 4 blue buttons below to narrow your search. For instance, if you click on PPGs by area, it takes you here. You will notice that Access and Privacy is the first in the list. If you click on the plus sign beside the department name, it will open up to show you which policies are located under that section. You can then click the plus sign again and open up the policy you're looking for. Access and Privacy PPGs are located in different sections as well. For instance, if you select the plus sign beside Administration, and again beside Legal Ethical Issues, you will see the Alternate Decision Maker and Legal Proceedings policies that belong to Access and Privacy that are located under this section and not under Access and Privacy. If you're unable to locate a PPG that is related to Access and Privacy, please don't hesitate to contact our department for assistance. We would love to help. Okay, on to technical safeguards, and this one is super easy. Creating secure passwords, using encryption software, and locking or logging off your workstation are 3 ways that you as an employee can help safeguard private information. Auditing of electronic access is another example of a technical safeguard, and the Access and Privacy Department performs random audits of user activity to ensure staff are only accessing the appropriate records needed to perform their assigned duties. Accessing appropriate records? What does that mean? Well, what a perfect segue into the introduction of the Access and Privacy Confidentiality poster. N2K is short for Need to Know, and is one of the fundamental concepts that I want you to take away from our time together today. This poster is located throughout Prairie Mountain Health facilities and programs and will help remind everyone to look only if you need to know, ask only if you need to know, and tell only if they need to know. You seen the pattern here? Appropriate access is determined by this obligation. Did you need to know, see, or hear this information to perform your duties? If you can answer yes to those 3 points, then you are obligated to only collect or share the minimum amount of information needed to perform your job duties. For instance, a clerk may not need a medical history to register an appointment, and environmental services wouldn't necessarily need to know a client's status or diagnosis in order to clean a room. N2K. This is what it comes down to, and if you're unsure whether or not you should share, use, or access confidential information, reach out to your manager or to the Access and Privacy Department. Some of you may be wondering where all these rules and regulations come from. Isn't that the kind of thing everyone spends their time thinking about? PHIA stands for the Personal Health Information Act, and the purpose of this act is to provide individuals with the right to view, receive a copy of, or request correction of their personal health information. This act also establishes rules that govern the collection, use, and disclosure of personal health information. We as an organization, and therefore you as an employee of this organization, are bound by law to protect and maintain each individual's personal and personal health information. A person who is found guilty of an offense under PHIA may be subject to a personal fine, and fines may range up to a maximum of $50,000. A breach may also involve disciplinary action up to and including termination of employment. This information isn't intended to scare you. We want staff to feel confident dealing with privacy and confidentiality in their roles and don't want to incite PHIA-noia. You see what I did there? Paranoia, PHIA-noia. Okay then. But we also want you to be sure you understand your obligations and ensure that you are complying with legislation and Prairie Mountain Health policy. The Mental Health Act takes precedent over PHIA. This act governs the admission and treatment requirements for patients in a designated psychiatric facility. From an access and privacy perspective, it also provides clients with the right to examine and receive copies of their clinical records and identifies the restrictions as it relates to confidentiality and protection of the clinical record within a designated psychiatric facility. PHIPA stands for Freedom of Information and Protection of Privacy Act. This legislation provides a right of access by any person to records in the custody of public bodies, like health authorities, meaning PMH. PHIPA also provides a right of access to any individual who wishes to examine or obtain a copy of records containing their own personal information in the custody of PMH. This legislation also regulates how public bodies manage personal information. Now, what does all that legal jargon mean for you? One example is that all emails that are created and sent with your PMH email address are considered business records and may be accessed by anyone requesting records under PHIPA, with limited exceptions. As you learned this morning in your ICT review, email is to be created and used in a professional manner as required in the acceptable use policy. So, maybe not the best medium to use when discussing Sally and her annoying mouth breathing and bad breath. Okay, enough legal talk. For now, let's take a little break and look at what some current PMH employees shared with us when asked what confidentiality meant to them.
My privacy is not your entertainment.
Knowing that I can trust you.
Facebook doesn't need to know.
Not keeping secrets from me.
Just because you work here and can access my information does not mean you should.
Confidentiality. Do you really need to know?
Ah, need to know. Where have we heard that before? Remember the N2K pledge, people? Look only if you need to know, ask only if you need to know, and tell only if they need to know. And then you're to only collect or share the minimum amount of information needed to perform the duties of your position. What kind of information must be kept confidential? It's pretty much everything, my peeps. PMH staff have a legal, professional, and ethical responsibility to protect all confidential information, oral or recorded in any form, that is obtained, handled, learned, heard, or viewed in the course of their work or association with Prairie Mountain Health. So essentially, anything you see, hear, read, or learn about when you're at work must be kept confidential and not shared with anyone unless it is required for them to do their job. Or in other words, unless they need to know, and then only the minimum that they need to know to perform their duties. So what constitutes personal health information? Personal health information means information that can be linked to a specific person and that relates to A, that person's health or healthcare history, including genetic information, B, the provision of healthcare to that person, and C, payment for healthcare provided to that person. This definition even includes general information about a person, such as name, address, gender, and date of birth, if that information is collected during a healthcare service or if it is used to administer payment for a healthcare service. Okay, does everyone remember the PHIA conversation from earlier? PHIA provides two primary rights: the right for an individual to access their own personal health information and the right to expect that the privacy of that information will be protected. The right to access includes the right to see the personal health information, get a copy of it, and request a correction to it. And the right to privacy includes the right to know why the information is being collected, the right to know what we are going to do with the information, and the right to have that information kept confidential and to request corrections to the record. Okay, one more time, just for good measure. The only time it's appropriate to view, use, or share personal health information is when it's required to provide care to the client. Or in other words, you got it, when you need to know and only what you need to know. Let's take a look at some common scenarios and test what you've learned so far about the appropriate viewing, use, or sharing of personal health information.
Hi, Dr. Spiky here. When Mr. Flathead was in the waiting room, I noticed that he looked terrible. What ended up being wrong with him?
Well, we've run a series of tests, and it looks like he's had a heart attack. And actually, probably not the first one.
Oh, that's terrible. He's such a sweet man. I used to live across the street from him and his wife for years. I'll have to send over a casserole and maybe ask my mother to check in on Mrs. Flathead.
What was wrong with this scenario? 1. Did Clerk Kathy need this information to do her job? No, she did not. The health or diagnosis of a patient isn't necessary for Kathy to perform her clerical duties, and Dr. Spiky Hare should not have shared this information with her. 2. Also note that Kathy would not be able to share the information she learned at work with her mother, or visit Mr. Flathead, or take him a casserole as the information about his health was learned at work. Although Clerk Kathy's intentions may be genuine, she would be in breach of the Prairie Mountain Health confidentiality policy, which states that confidential information, oral or recorded in any form, that is obtained, handled, learned, heard, or viewed in the course of their work or association with Prairie Mountain Health must remain confidential. This is in the PMH confidentiality policy that you will be required to review in your next stage of orientation to your specific department.
OMG, Shirley is in and she just had her baby. She's so cute. Thanks so much for sharing. I'm off for the next couple of weeks, but I was thinking about her. Thanks for giving me the heads up.
What is wrong with this scenario? 1. Did Nurse Nancy need to know this information in order to perform her duties? She did not. PMH Polly was not at liberty to share this information with Nurse Nancy, as she was not at work, so it wasn't necessary for the current care of the client. 2. And again, PMH Polly isn't able to share the information she learned at work with Nurse Nancy, as she would also be in breach of the PMH confidentiality policy, which states that confidential information, oral or recorded in any form, that is obtained, handled, learned, heard, or viewed in the course of their work or association with Prairie Mountain Health must remain confidential. Exciting and positive personal health information is still protected under PHIA, and it's important to remember that you're not in a position to share the information you learn at work. You are allowed to ask the client for their permission to share information you have learned at work with friends, families, or coworkers, but always remember that it's not your story to tell. As you heard earlier from one of the PMH employees, their privacy is not your entertainment.
I'm so nervous about my MRI results. I wonder what they found.
Why wait for your doctor's appointment? You can look up your results right now. The information's just sitting there calling your name. No one will ever know.
You're not allowed to access your own information. It's against policy, and you'll get into a lot of trouble when Access and Privacy does their auditing. Let's just wait for your doctor's appointment next week.
What was wrong in this scenario? 1. Staff are allowed access to their personal health information, but they must follow the same procedure as everyone else. All Susie needed to do was complete a request to access personal health information form and submit it to her privacy officer. The privacy officer would then either assist Susie with viewing her results or provide her a copy of her information. 2. The Access and Privacy Department audits user access, and if the audit of user activity shows that you viewed or printed your own personal health information, or information belonging to your family, friends, coworkers, etc., when not part of your job responsibility, there will be a privacy investigation. How does that Nike slogan go? Just don't do it. Oh, wait. Anyways, you get my point. Don't do it. Oh, social media, you bring us such joy and such pain. Social media sites such as Instagram, Snapchat, and Facebook are common tools for communication and interaction in today's world. PMH has social media sites of their own, and they provide a lot of benefits. However, from a work-related perspective, you can get yourself and your coworkers into a lot of trouble.
Love my job. Love this girl. Hashtag work. Hashtag BFF.
What is wrong in this scenario? I'm not even going to leave you time to think about this one. And most of you are probably immediately thinking, who would do that? And you're right, who would? Not a Prairie Mountain Health employee, but I've heard of this insanity at other organizations, and it seems like it's a no-brainer. But it happens. 1. This scenario depicts a violation of the patient's confidentiality. It has been posted without their permission for the world to see that they are receiving care, not to mention the policy violations. 2. Prairie Mountain Health has policies regarding cell phone use during work hours, and you need to discuss the policies and practices for your area with your manager. 3. There is documentation posted throughout Prairie Mountain Health regarding the use of cell phones and the taking of pictures. 4. The same scenario would apply if there was a display board with client names, binders or records that have the client's name listed and in view, or other PMH employees or staff information. When it comes to social media, here's a few tips about how to protect yourself. Do not post personal health information or photos of clients or coworkers without specific authorization, even if they can't be identified. Do not post photos or videos that reveal room numbers or client records or locations at work where our clients are vulnerable, like the operating room. Even though the client may be draped and not identifiable, it still can create a feeling of mistrust to people who see it when they are in a vulnerable situation. Do not post descriptions of clients, their medical conditions, and/or treatments. Do not refer to clients or other PMH staff in a degrading or demeaning manner. Be careful not to include negative connotations about having to go to work or how long you've had to work, as it can reflect negatively on you as an employee and for the organization. Seriously consider the implications of accepting invitations from clients to their or your social media platform. Please be sure to discuss these PMH policies and procedures with your manager. Prairie Mountain Health staff need to remember to always be aware of their surroundings.
Yeah, hi, Mr. Dumbledore. Your test results are in, and that rash on your groin, it's gonna need a prescription.
You're probably sitting there thinking this is an obvious one, right? But what if she had said, Mr. Dumbledore, your test results are in, and you're going to need to begin insulin. Or the x-ray shows you've broken your femur. The type of diagnosis being discussed loudly and in front of others isn't the issue. The volume and information being discussed is the problem. Keep your voice low and only share the information that is absolutely necessary so that others in the waiting room or the next bed don't overhear needlessly.
Yes, it's finally my turn. Yes, I've been waiting out there forever. Will my family even remember what I look like? Is that my information on the screen there? Oh, look, there's my lab results from last week. This is kind of cool. I wonder what wifey's blood pressure is.
Okay, team, what's the problem here? 1. Although it may initially appear that the client is in the wrong for accessing this information, it is the staff member that is responsible for the privacy and security of the information we store. The staff member that pulled up the client's information on the computer had a responsibility to secure the information using a technical safeguard, like a password. This would have made the information easily available to the provider when they came into the room, but would also serve to protect it from those curious cats out there. 2. As a PMH staff member, you need to be aware of your surroundings, and that includes taking extra precautions to make sure confidential information isn't accessible to those that don't require it to perform their duties. The same principle applies to paper records. Please don't leave these lying about where clients and/or the public can see and access them. Esteemed colleagues, our time is coming to an end. Remember to always use your privacy tools, which are your administrative, physical, and technical safeguards. And may the need-to-know concept be forever in your heart and minds. The Access and Privacy Department is here to support Prairie Mountain Health employees and encourages staff to reach out with questions or concerns with any privacy or security matter. Our contact information is provided on our intranet page, which is simply found by clicking on Programs and Services, Information Services, and then on Access and Privacy. And our email couldn't be easier to remember, privacy@pmh-mb.ca. I'm sure by now your brain is full and your sides must be hurting from laughter, so I will sign off and say good luck with your future PMH career, and we look forward to meeting you soon.